And our very own Stephen Leto joins us here in the studio. And Stephen, you know, first thing, we have to maintain distance, right?
And of course, great this way.
Okay. Mambo.
Fitting.
How serious are things out there, Leto? You've been covering this story from day one. How serious is it?
The coronavirus continues to send worrying headlines across the globe, Kenya not being an exception. And the issue of the coronavirus, for instance, has totally uprooted the lifestyles of not only Kenyans, but the global population. If we have covered this for a period of time now, for 3 days, constantly interacting with government officials, even when you look at their faces, it tells it all, that the situation is very serious.
So what you're saying is some of the information we're getting may not be accurate or may not be forthcoming?
There is a trend in which we are receiving information from the Ministry of Health. First, we had one case. The second, we had 2 cases, and then went to 4 yesterday. And today, we are given 3 more patients testing positive to the COVID-19, that making it 7. That tells you that tomorrow, should we be called to for a press conference, we might be given another more numbers rising. And so the trends keep on rising. And as the ministry has clearly stated, that it is Kenyans coming from abroad, back home, that are being the prime carriers of the COVID-19.
I guess the biggest fear, Leto, is the fact that, yes, what you mentioned, Kenyans coming from abroad. When it becomes local to local contact, then we should be very worried.
Indeed, because one of the questions that we posed to the Health Cabinet Secretary Mutahi Kagwe is concerning the transport or the public transport system that is still running. And the number of people that the government announced today that it is trying to seek where they are is 85. 85 is the number the government is narrowing down to have been the number that has interacted with all these coronavirus patients that have tested positive. What happens? Where are these 85 people? Who have they interacted with? So that is the big question that the government is now grappling with, to see who are the people that have interacted with the positive cases. Remember the woman who sneaked out of hospital and was sought again, taken back to hospital and was found positive. How many people did that woman interact with that now might be suspects of the coronavirus?
And finally, Leto, let me ask you this. Kenyans who you interact with, are they worried? Do they care? Do they even know what's going on?
What majority of Kenyans, Jeff, are worried now is how their lifestyles are changing. Apart from really getting worried with the coronavirus itself, they are worried about how their lives is changing. But one of the key issues is the information on testing. Kenyans, there are majority of Kenyans who want to go to the health centers and get tested. But the government is telling them, we cannot test you. We can only test whoever is exhibiting the threshold of possible infections on coronavirus. And so that is one of the very critical issues that is out there that the Kenyans really want to know. And remember, there are only 2 testing centers in the whole country. That is the National Influenza Center as well as KEMRI. Those are the 2 centers that the government has designated to test the COVID-19 thing. And so that is part of the issues that Kenyans and the county governments once addressed and even devolved to the county referral hospitals. And lastly, the bosses at the World Health Organization are even now doubting numbers in Africa, saying that the African countries might not be having the necessary or the capability to test whether a patient is positive to COVID-19 or not. And so that begs the question, our 7 numbers, Rwanda 16, South Africa's 116, what happens to those numbers? Are they real patients for COVID-19, or they are still suspected, and that African governments are saying that they are COVID-19 patients? That is, of course, what we are waiting to see again and to hear from the Kenyan government, how they will be responding to the World Health Organizations with regard to the capability to test the COVID-19 positive or negative cases. Jeff.
Samuel, so thanks so much, my friend. And be safe out there, huh? Thank you so much.